Hello, welcome back. Today we're going to talk about type 2 diabetes. Type 2 diabetes isn't just a diagnosis, it's a daily reality for millions of people, including many veterans and families I've worked with. It affects how the body processes energy, how the brain functions, and how someone feels day to day. But here's the truth. With the right knowledge and support, it's manageable. In more than that, it's an opportunity to reclaim health, dignity, and control. In this video, we will break down what type 2 diabetes really means. Not just the clinical terms, but how people are coping with this condition. We will explore how insulin resistance develops, why it matters, and how it quietly affects your heart, kidneys, nerves, and emotional being. You will learn how food, movement, and mindset can work together to support your health without shame, fear, or confusion. Because healing isn't just about perfection, it's about progress. Whether you're newly diagnosed or caring for a loved one or simply trying to understand, this presentation is for you. It's a place for clarity, compassion, and confidence. I'm here to walk with you, sharing tools that are practical, science-based, and rooted in care. Let's take the first step together and begin a journey toward feeling whole again. So, what is type 2 diabetes? Type 2 diabetes isn't just about sugar. It's about how your body handles energy. Every bite you eat, every breath you take, and every step you take is part of a complex system that keeps you going. At its core, type 2 diabetes is a condition where the body either resists insulin or doesn't produce enough of it. Insulin acts like a key, helping your blood glucose, which is your main body's fuel, enter your cells. When that key doesn't work, glucose or blood sugar builds up in the bloodstream instead of nourishing your body. This buildup doesn't just affect blood sugar. It quietly impacts your heart, kidneys, nerves, and vision. And because it usually develops slowly, many people don't notice it until complications arise. It can feel invisible, creeping in over months or even years. That's why understanding the condition is very important. It's not just about the numbers on a lab report. It's about how you feel, how you function, and how you live. The good news is type 2 diabetes is manageable. With the right knowledge, support, and small consistent changes, you can take back control. Nutrition, movement, and mindset are not just buzzwords. They are important tools for healing. And in this series, we will explore how to use them in ways that feel doable, compassionate, and rooted in everyday life. You are not alone in this journey. You don't have to figure it out all at once. Type 2 diabetes doesn't always announce itself loudly. It usually creeps in quietly through subtle changes that are easy to dismiss. You might feel fine for months, even years, before the signs begin to show. But those symptoms are not random. They are your body's way of asking for help. Excessive thirst, frequent urination, fatigue, blurry vision, and slow healing wounds are all signals that something's out of balance. Tingling in the hands or feet, or dark patches of skin around the neck or armpits may seem minor, but they are part of a bigger picture. These signs reflect how insulin resistance is affecting your nerves, circulation, and skin. And for many people I've worked with, including my veterans, these symptoms were brushed off until they become harder to ignore. That's why awareness matters. The sooner we recognize the signs, the sooner we can take action. This is not about fear, it's about empowerment. When we listen to our bodies with compassion and curiosity, we usually open the door to healing. Type 2 diabetes is manageable, and recognizing the symptoms is the first step. You are not alone in this. Whether you're noticing these signs in yourself or someone you love, this video is here to help and guide you with clarity, care, and hope. Type 2 diabetes doesn't just happen overnight. It's rarely caused by just one thing. Genetics play a role, especially if you have a family history of diabetes. But lifestyle factors like diet, physical inactivity, chronic stress, and hormonal conditions such as polycystic ovary syndrome or gestational diabetes are also powerful contributors. These factors don't just influence blood sugar, they shape how your body is processing energy, storing fats, and responding to inflammation. Certain ethnic backgrounds also carry a higher risk, and age can increase vulnerability, especially after the age of 45. But here's the empowering truth. While we cannot change our genes, we can certainly change our environment. Every meal, every walk, every moment of self-care is a chance to shift the trajectory. Prevention isn't about perfection, it's about progress. And intervention doesn't mean starting over. It means starting where you are with what you have. The good news is we have the tools, we have the knowledge, and we have the ability to make meaningful changes that support your long-term health. Whether you are at risk or already managing type 2 diabetes, this journey is about reclaiming control, not just of your numbers, but of your life. And I'm here to walk with you every step of the way. Type 2 diabetes develops quietly. Many people live with it for years before they are diagnosed because the symptoms can be subtle, gradual, and easy to overlook. Fatigue, thirst, or blurry vision might be brushed off as stress or aging, but beneath the surface, elevated blood sugar may already be affecting the heart, the kidneys, the nerves, and the eyes. That's why early detection matters. It's not just about catching a condition, it's about protecting your future. Screening is simple. A quick blood test like the A1C, fasting glucose, or oral glucose tolerance test can reveal how your body is processing blood sugar. These tests don't just give numbers, they offer insights into how your metabolism is functioning and whether your cells are getting the energy they need. If you have risk factors like family history, excess weight, high blood pressure, or a history of gestational diabetes, screening becomes even more important. The good news is you have time, you have the tools, and you have the power to act early. A few minutes at the clinic could change the future of your health. It's because when we catch type 2 diabetes early, we can intervene with nutrition, movement, and support. before complications begin. It's not just about managing a diagnosis, it's about reclaiming your energy, your clarity, and your confidence. Managing type 2 diabetes isn't about chasing perfection. It's about building progress, one choice at a time. I've seen how overwhelming it can feel at first, especially when the diagnosis comes with fear or confusion. But healing doesn't require dramatic overhauls. It starts with listening to your body and making small, meaningful changes that support your health every day. Start with food, choosing fiber rich, low glycemic carbs over refined carbs helps keep your blood sugar steady and energy levels more consistent. Movement matters too, not just for glucose control, but for mood, circulation, and confidence. Even 30 minutes a day of exercise, such as walking, dancing, or stretching, can improve insulin sensitivity and help you feel more grounded. And if weight loss is part of your journey, know that even a modest reduction for 5 to 7% of your body weight can lead to a powerful improvement in blood sugar, blood pressure, and cholesterol. But it's not just about food and fitness. Sleep and stress play a huge role in how your body heals. Prioritizing rest, finding moments to breathe, and letting go of what you can't control are just as important as what's on your plate. So today, choose one thing. Add a vegetable to your meal. Step outside for a walk. Turn off your phone an hour before bed. These small steps add up, and over time, they build a foundation of strength, stability, and self care that your body and your future self will thank you for it. Medication isn't failure, it's support. I've worked with many people, including my veterans, who are not sure about starting medication, worried it meant they'd lost control. But the truth is, medication is a tool. It's part of a larger care plan that includes nutrition, movement, and mindset. And when used thoughtfully, it can help your body do what it's struggling to do on its own: regulate blood sugar, protect your organs, and restore energy. Medications like metformin, the GLP-1 agonists such as semaglutide, Manjaro, and Jardins are designed to support insulin function, reduce blood glucose levels, and lower inflammation. They don't replace your efforts, they amplify them. And when oral medications are not enough, insulin therapy may be needed. It's not a punishment, it's a lifeline. Insulin helps move glucose into your cells, where it can be used for energy. Over time, the pancreas may produce less insulin, or the body may become more resistant to it. That's when insulin becomes a vital part of the toolkit. Whether it's temporary boost during illness or a long-term part of your care plan, medication can prevent serious complications and protect your heart, kidneys, nerves, and vision. And when paired with healthy habits, it becomes part of a powerful and personalized strategy. You're not alone in this. Your doctor, your nurses, your dietitians are here to guide you. Your choices matter, and together, your treatment plan can help you feel better, live well, and take back control. Monitoring your blood sugar isn't just a task, it's a form of self awareness. It helps you understand how your body responds to food, movement, stress, and medication. There are two main ways to track your levels: self monitoring of blood glucose, or SMBG, gives you real time feedback using a meter or continuous glucose monitor. You can check before meals, after exercise, or when something feels not good. It's like having a conversation with your body, one that helps you make informed choices. The A1C test, on the other hand, offers a long term view. It's a lab test that shows your average blood sugar over the past 2 to 3 months. Even if your daily readings look okay, your A1C can still reveal hidden patterns or risks. It's a vital role for understanding your overall progress and adjusting your care plan. And whether you're using finger sticks or a wearable sensor like the Libre system, there are ways to make monitoring more comfortable. Prick the sides of your fingertips, not the tips, and rotate fingers to avoid soreness. These small adjustments can make a big difference in consistency. And consistency is the key. When you monitor regularly, you give yourself and your care team a full picture, one that guides decisions about medications, lifestyle changes, and long term health. Whether it's a quick scan, a finger stick, or a quarterly lab test, monitoring is just how important to stay informed, empowered, and prevent complications. It's not just about numbers, I said. It's about knowing your body and taking control. This isn't meant to scare you, it's meant to empower you. Type 2 diabetes, when left unmanaged, doesn't just affect blood sugar. It quietly touches every part of your body: your heart, your kidneys, your nerves, your eyes, and even your brain. These complications, like heart disease, stroke, nerve damage, kidney failure, vision loss, and mental health issues, are real, but they are preventable. They are warnings, not predictions. I've seen what happens when people feel overwhelmed and delay care. But I've also seen what happens when someone takes that first step, when they choose to learn, to act, and to believe that change is possible. With the right support, you can protect your health, preserve your independence, and stay present for the moments that matter the most. Keep thinking about the future of your child walking down the aisles, dancing at a family reunion, or simply waking up with energy and clarity. Prevention gives you those possibilities. And it starts with one decision, one conversation, one step forward. You don't have to do it all alone or do it all at once. Managing diabetes is about reclaiming your future, one choice at a time. And I'm here to walk with you, offering tools, encouragement, and care every step of the way. Type 2 diabetes doesn't have to be a life sentence. It's a challenge, yes, but can be managed with knowledge, support, and daily choices that move you toward healing. Lifestyle changes are not about perfection, they're about progress. Even small shifts, like choosing whole grains over refined carbs, walking after meals, or carving out time to rest, can lead to powerful improvements in your blood sugar energy, and overall well being. Medical support tools like glucose monitors, medications, and regular check ins are not signs of failure, they are signs of strength. They are tools that help you stay in control, prevent complications, and respond to your body's needs with clarity and care. And you're not alone, like I said. Community matters, education matters. When you have access to clear, compassionate information and people who walk beside you, the fear begins to fade. In its place, confidence grows, action becomes possible. So let's rewrite the story of diabetes. Let's do it one meal, one step, one conversation at a time. Because every choice you make, every question you ask, and every moment you show up for your clinic visit send a powerful effect of your future. You are not just managing a condition, you're reclaiming your power, and the power is hope. Providing comprehensive, patient centered care is about more than treating conditions, it's about uplifting lives. When we focus on prevention, early detection, and personalized treatment, we help people feel seen, heard, and supported. That's the heart of healing. And it's the mission behind every video, every consultation, and every resource I create. You deserve clarity. You deserve compassion. And you deserve care that honors your story. We aim at empowering individuals with science based insights and practical tools. We help them take an active role in shaping their future. This presentation is for everyone who is interested in managing type 2 diabetes or learning about the condition. Thank you for watching. If this helped you, share it with someone you care about because knowledge grows stronger when it's shared. Subscribe for more videos that blend science, compassion, and clarity. And if you're ready for personalized support, reach out to us at Dietitian Alliance. We are here to walk with you every step of the way. Thank you so much.